Thanks very much, Afric. It's great to be here. I've really enjoyed all the talks so far. Looking forward to those to come as well. So yeah, thank you for inviting me. I am here to talk about bioenrichment as a method to increase the vitamin D content of primary agricultural products. So I work for Devnish Nutrition and I'm a project manager on the food innovation team, as Afric explained there. So what I'm going to talk about today is just briefly who Devnish Nutrition are, what exactly is bioenrichment, what am I talking about when I am using the term bioenrichment, why is there a problem with vitamin D? I know most people have actually already covered this, so I won't spend too long on that. How we can affect change as an animal feed company, as a food innovation team, and some of the work we've done so far on chicken, pork, and a bit on cow's milk. So who are Devnish Nutrition? If any of you don't know Devnish Nutrition, we are a knowledge-based global group delivering innovative solutions to improve animal, human, and environmental health simultaneously. Really at the heart of Devnish Nutrition and what the company was originally when it was first bought by the current owner is an animal feed company. So we manufacture premixes and animal feeds. And while we have always been concerned, and it's been our mission to ensure that animals receive optimal nutrition through the feeds and the premixes that we supply, to ensure they can achieve their growth potential and whilst maintaining optimal health at the same time. We've gone further now as a company, and we're concerned not only with the nutrition and the health of the animal, we want to go one step further, and we're now concerned with the nutrition and the health of the consumer that is eating the meat, milk and eggs from the animals. So that really is where the food innovation team comes in. We're a global company. We have 3 plants in America, 1 in Mexico. We have multiple sites in Belfast, which is where we originated. Headquarters are in Belfast. And we have offices kind of all over the globe. So that's who Devnish Nutrition is, in case anybody was unsure. And the food innovation team then at Devnish, so our mission statement really is that we seek to support agriculture by adding value to the food via the feed, thereby improving the nutritional content, the quality, and or the assurance attributes of the food that we eat. And in doing that, we are supporting our customers, building partnerships along the food chain. But ultimately, what we want to do is to improve public health through more nutritious food and also possibly improve consumers' eating experience. And Devnish, the ethos at Devnish really is that we have to look at food production as a full chain, so from start to end, from soil to society. So we believe that by going right back to the basics of soil nutrition and ensuring that the soil contains the correct nutrition for optimal growth of crops, that we can improve nutrition every step of the way along the food chain. So if we have the best possible soil, we have the best possible crops coming from the soil, the animals are getting the best nutrition, more nutritious products are being produced from the animals, and therefore the consumer is getting a more nutritious product, and ultimately there can be an effect on population and environmental health. So that's just a bit about food innovation and Devnish. So bioenrichment, when I use the term bioenrichment, you may have heard this sort of work being referred to before as biofortification, but we prefer the term bioenrichment, as fortification possibly implies that the micronutrient is being added during the processing of the foods, whereas this is bioenrichment through the animal's feed, or the housing of the animal, or the management of the animal. So that's what I mean when I'm talking about bioenrichment. And we define it as the supplementation of primary animal products with specific nutrients delivered through the animal's feed and or management, which improves the health of both the animal and the end consumer. And one of the micronutrients that we are concerned with and have been doing some work on at Devnish is vitamin D. And that has been my main area of research over the past few years. So why are Devnish concerned with vitamin D, or why is it of interest to us? Well, there are a number of reasons. First of all, there are significant deficiencies in the diet. There's no getting away from that. It's widely known. It's been reported and talked about by many people before me, even today. Secondly, there are scientifically proven and independently validated health benefits to having the correct amount of vitamin D in your diet. So we don't have to start proving that. That's already well known. Thirdly, and importantly to us as a commercial company, there's really good consumer awareness of vitamin D, both of the deficiency problem that we have and of the need to have enough vitamin D in your diet, or from sunlight, or from supplements. So consumers are aware that vitamin D is important for health. As an animal feed company, there are animal health benefits. So it's really important to us that whilst we want to ensure the products we are producing for the consumer are enriched with vitamin D for their health, it's important that the animal is also getting enough vitamin D and is as healthy as possible as well. And that has been the case. We've seen no detrimental effect to any animals, anything that we've done. And it's important as well from a consumer's point of view that they know that any of the work that we're doing is of benefit to the animal as well as themselves. And lastly, but really importantly, the health claims that are associated with vitamin D are really consumer friendly. So we all know that the health claims are healthy bones and teeth, maintenance of muscle, immune function support. These things are easily understood by consumers. Some health claims associated with other micronutrients are a bit obscure. These ones are easily communicated. So if we are able to use a health claim, so if we achieve the level of vitamin D in products that we need to use these health claims, then the message we can put on the packaging is easily understood by the consumer. So that's really important to us as well, also as a commercial company. So why is vitamin D a problem? Now, people have covered this before, so I'm not going to spend too long on it. But from our point of view, if we look at the levels of vitamin D in primary agricultural products specifically, the orange line in this graph is source of level, and the green is high in level. So it's been covered before, but just to recap on that, if you achieve 15% of the recommended daily intake of vitamin D, you can use a source of claim. So you can say that your product is a source of vitamin D. And if you achieve 30%, you can say that it's high in or rich in. So if you look to the left-hand side of this graph, we have milks, and then lamb and chicken and beef. And these are the more widely consumed cuts or portions of meat and of agricultural products, and they don't achieve the source of levels. So they don't have vitamin D in there at a significant level that may have an impact on your vitamin D status and your health. The ones that do are unfortunately the ones that are not widely consumed, so they're awful. Eggs are in there, and eggs are consumed, which is great. But really, looking at that graph, the widely consumed portions do not contain enough vitamin D. So that's one of the reasons why we don't have enough vitamin D. Another one is where we live. I know not everybody is based in the UK or Ireland that's on here today, but this red line at the bottom of the map is 51 degrees north. It's really around Southampton in England, which is a good bit further south from where I am at the minute, and a lot of us probably are. And for up to 6 months of the year, at latitudes above 51 degrees north, we can have what is called a vitamin D winter. So even if it's a lovely sunny day, a lovely crisp autumnal day in October or November, and you're out for a walk, you're actually not making vitamin D because the angle of the sun is not high enough to supply enough UVB light for cutaneous synthesis. So that's another reason. Also, if there's cloud cover, or if there's an ozone event or anything else in the atmosphere, that can stop UVB light getting through as well in summer. So there is a problem with where we live. And so they're just really that ultimately there aren't enough sources of vitamin D. So naturally occurring sources that are high enough to achieve health claim levels are eggs, as shown in the graph before, and oily fish. And unfortunately, oily fish are not widely consumed. The other ways we can get vitamin D in the diet are through fortified products, such as fat spreads, breakfast cereals, bread, and then we can take supplements, but unfortunately supplements are not necessarily taken regularly as they should be. And then, of course, we're all aware that we can make vitamin D through the action of UVB light on our skin. So how can we affect change as an animal feed company and as a food innovation team? So we've looked at this really in 3 different ways. So this little graphic of vitamin D metabolism's probably a bit simplified, but it illustrates what we're doing. So the first way we have looked at vitamin D bioenrichment is cutaneous synthesis in the skin of the animal. As we're all aware, the action of UVB light on 7-dehydrocholesterol in the skin allows us to manufacture our own vitamin D. Unfortunately, a lot of animals are raised intensively in that they don't actually ever go outside. They're housed the whole time. So this would be true, especially where I am, for broilers, for chickens, and for pigs for pork production. So what we have simply done is replace the sunlight that those animals would be getting if they were outside in their houses. And we've had great success with that, which I will cover in a few moments. The second way we have looked at this is looking at dietary sources of vitamin D in the animal's diet. Now, I was interested in Corwin's talk earlier where he was talking about the recommendations as opposed to the regulations they have in the US, but unfortunately here we're really restricted in the amount of vitamin D we can add to animal feed. And everybody adds the maximum level. So there's an EU maximum level set. Everybody adds that maximum level, and it doesn't result in enrichment of meat. So we have to look at other things. So what we did was we looked at the 2 different metabolites of vitamin D. So we looked at a 25-hydroxy and a 125-dihydroxy in the diet. I'll show you in the next few slides that unfortunately they didn't increase the vitamin D level in the meat. And then the last way we were able to look at increasing vitamin D in the meat was through exploitation of the metabolic pathway. We did this in 2 ways. We found a compound that was a precursor in the metabolic pathway of 7-dehydrocholesterol. And the thought process behind that was if we were able to upregulate the production of 7-dehydrocholesterol in conjunction with UVB light, could we obtain more vitamin D? Unfortunately did not work. The second compound we found was there was research carried out in human study, and this compound upregulated the production of vitamin D binding protein and vitamin D receptor in the participants, but it did not work when we used it in the animals. So if we go to chicken first. So this graph shows the level of vitamin D that we have been able to achieve in 2 different portions of chicken. So on the left-hand side of the graph are for breast results, and then on the right are for leg results. So the leg results are higher. Leg contains a lot more fat, and vitamin D is a fat-soluble vitamin, so that's to be expected. But if you look at the third column across is control. So that is a standard chicken reared in a normal way that it would be anywhere really in the UK on a standard diet with the maximum amount of D3 that everybody already adds to their feed. And as you can see, the level falls far below the source of level that is required for a health claim. And I have included the 125 and the 25-hydroxy metabolites that we added to the feed, and neither of them were able to achieve source of levels. But when we used UVB light, we did achieve source of levels. And so that it shows that UVB light is the one that works. Similarly, on the left, we have our 4 leg results, and it followed exactly the same pattern. So the control, the 25 hydroxy, there wasn't much difference between them. 125 knocked it back a little bit, actually, but you can see the increase when we use UVB light in those animals. So this proved that we can increase the source of levels using UVB light. Now, there were many iterations and different regimes of the UVB light that we had to trial before we reached this one, but we have consistently been able to achieve source of levels and this great increase in chicken meat. So we actually got 110% increase above control in breast meat and 70% increase above control in leg meat. So we're very happy with those results. Then we had done some work looking at pork and cow's milk. And when we first decided to look at these 2 products, we actually got a project funded by the Agri-Food Quest Competence Centre. We got around £175,000 for this project. The partners were Caro from the pig side, ourselves, Thompson's manufactured the feed, and Dale Farm from the dairy side. And the research institutes were AFBI, University of Ulster and Caffrey from Northern Ireland. The layout of this study, there was one additional dairy study. I've included this because I want to show on the next slide an interesting graph. But we carried out 2 dairy interventions and 1 pig intervention with a dietary treatment and UVB light. So if you remember back a few slides when I was talking about a vitamin D winter, I think this slide's really good because it illustrates it. So we were able to piggyback on a study that was already going on at AFBI. They were looking at 0 grazing versus silage versus pasture in dairy cows. Now, if anybody's unfamiliar with the term 0 grazing, it just means that fresh grass is cut outdoors and brought into the cows so that they can eat it indoors. So these cows were all housed indoors. Except for the pasture. So the cows out of pasture obviously were out 24 hours a day eating grass and exposed to the sun. The graph on the left was these results are from the 6th of July, height of summer. And as you can see, there's a vast difference between the pasture results and the 2 indoor treatments. But if you look at the graph on the right, which was taken on the 20th of September, so still really kind of summer, you would think here. But look, if you see the decrease in the amount of vitamin D in the milk from the animals that are still out 24 hours a day, I just think it's a really good way of illustrating the vitamin D winter. So I just wanted to include that. The dairy studies that we carried out, we did not increase the level in the milk to anywhere near health claim levels. And because I only have a few minutes left, I'm not going to actually cover those results. So it's not something that we've taken forward, but it's still on our agenda. So if we look at the pig study, then the setup was we had 24 pigs in each of 2 rooms, so 48 altogether. We had 3 dietary treatments and each house either had UVB or no UVB. And the results from that initial study were not as exciting as we had hoped they would be. So the control on the left doesn't reach health claim levels, and the UVB exposed meat on the right is just above health claim levels. Now, when we carried out this first study, we were, I would say, very cautious on the amount of UVB we gave the animals. It was hardly anything at all, to be perfectly honest. But we did achieve a 12% increase with UVB. But this was interesting to us, so we commissioned another study in the same place, same setup. This time there was no dietary intervention, so it was control feed, so maximum amount of vitamin D allowed plus UVB light versus control. And as you can see, there is a big difference this time between control and UVB loin. We increased the exposure to UVB light. We revisited the calculations, we changed the bulbs, and we were able to expose them for quite a bit longer with no detrimental effect to the pigs, no redness or burning or anything. And this time we were able to achieve a 50% increase in vitamin D3 content of the meat from control to UVB light, which we're delighted with. So really, Devnish and the food innovation team at Devnish, our overall aim is to provide the consumer with more dietary sources of vitamin D and to help alleviate the vitamin D insufficiency deficiency problem that we have. I think, Afric, you were talking earlier in your presentation about affecting change in behavior in consumers. And we don't believe that we're going to be able to do that. So what we want to do is provide alternatives. So if we can just provide a vitamin D enriched packet of chicken breasts on the supermarket shelf alongside the standard, and it's just a matter of the consumer lifting the vitamin D enriched chicken, then I think that's the way we're going to be able to do this. But we have proven that we can increase the vitamin D level to health claim levels in both pork and chicken. And that's me. I would just like to make a couple of acknowledgements and thank yous to people that have helped us along the way. So Kirsty, Chris, Holly and Erica and the team at UU, the team at AFBI, especially Colin and Ruth, and Steph and Durand, AFQCC for funding for that first initial study. Our industrial partners, Caro Thompson's and Dale Farm, and then Fiona and Rushing at Caffrey, and my colleagues at Devnish, especially Dr. Eva Lewis. That's me. Thank you.